Hello, dear friends. It's good to be with you again, and I'm really excited because I got some feedback from you folks that I'm going to incorporate in this particular session of our discussion today. If you recall, we'll be talking about medical conditions in pregnancy, and we are focusing on hypertension. I've talked about pre-pregnancy state, I've talked about the first trimester, and today I'll be talking about the second trimester, how to deal with hypertension in the second trimester. But meanwhile, we got a feedback from one of our enthusiastic followers, and she wanted us to talk about how to cope with a miscarriage. So I'm going to take a detour and talk about that first for like probably 60 seconds or thereabouts. Then I will go back to our usual series. So for that particular viewer or that particular person who follows us, who wants to talk about miscarriage. Miscarriage really could be something devastating. A lot of people underestimate the impact that may have on the mother or even the expectant parents, and then they don't really know that it can have significant psychological impact on them. So for anyone who has had a miscarriage, the first thing I'll let you know is that it's unfortunate, and in most cases it had nothing to do with what you did or you didn't do right. It just happens. Many times people with miscarriage have that experience because the natural system realized that that baby will not fare well at maturity. So many of the cases of miscarriage are due to genetic or chromosomal abnormalities. And when these abnormalities occur, instead of allowing the pregnancy to go to term and babies with an abnormality are born, the natural system just clears off the baby very early. It's really unfortunate because the family is expecting a baby to come. So what you would do if that has happened, sorry about that. The first thing I ask you to do is to investigate what may be the possible reason. In many cases you may find nothing, but it's important to investigate. So go to a caregiver, get investigated, they will do some blood work for you, do some other investigations, also be sure that there's nothing being missing. And that's, if nothing is there, the next thing is to ask you to try again, okay? And wait, you can take a break. People advise to take a break for like a month or two, then you try again. And when you get pregnant, it's important to book that pregnancy early and start receiving care from your caregiver. While you're trying, it's very important that you start folic acid, because that is going to help you with a lot of things. Really, I emphasize folic acid a lot. It's better for you to start taking folic acid immediately because it helps to prevent complications such as neural tube defect, which is associated with miscarriage. So I will stop it at that and come back to talk about our main event, which is hypertension in the second trimester. Now, hypertension in the second trimester is not different from the way you manage the first trimester. I believe that at this point in time, you would have been on antihypertensives that are safe for your pregnancy. So what is important in the second trimester is that keep taking your antihypertensive that you started in the first trimester. I assume that those antihypertensive drugs are the ones that are safe in pregnancy. There are particular antihypertensive drugs that are safe in pregnancy. If you were not taking that, it's important to switch to antihypertensives that are safe in pregnancy by the second trimester. Second trimester is also unique in the sense that for most pregnant women, it's expected that the blood pressure drops significantly in the second trimester. So for women who are hypertensive, it's expected that if everything is going well, even their blood pressure will come down a bit. So you expect your antihypertensive to be very effective at this point in time. It's covered that your blood pressure will drop, because that's the natural order. But it's important to also mention that for a few women who are hypertensive, if they want to develop preeclampsia or superimpose preeclampsia on existing hypertension, this occurs during the second trimester. You have to keep an eye on that also, because the blood pressure may also shoot up and it may be difficult to control with the normal usual hypertension. So it could go both ways. That's the message I'm passing across. So you have to be careful. So you be vigilant with your care. So women who are hypertensive and are pregnant need to pay more visits to their caregiver. That is really important at this particular point in time, because you need to watch out for your blood pressure, watch out for your weight gain, and watch out for protein in your urine, because that may be the earliest sign of a superimposed preeclampsia. Other investigations will also be done, because you need to watch out also for your electrolytes, urea, creatinine, and uric acid. If there's elevated uric acid, it makes us worry about superimposed preeclampsia. So this time is not the time to stay at home. Second trimester is when you need to visit your caregivers more frequently, so that we can rule out the possibility of superimposed preeclampsia on existing hypertension, or we can see if your blood pressure, your medications are working effectively to keep your blood pressure under control. So till we meet next time, take care and bye.